Since the early 2000s, the number of robotic-assisted surgeries in this country has just skyrocketed. The key here is that it's robotic-assisted. It always takes a surgeon to run the show. And our guest today is Dr. Pranav Sharma. He is a urologist and Texas Tech physician, and he's here to explain a little more about robotic-assisted surgery, so we'll understand if our doctor poses that as an option for us. Nice to see you, Dr. Sharma.
Thank you.
First, why don't you tell us, what does it mean when somebody says you're going to have robotic-assisted surgery?
So robotic-assisted surgery is just a fancy form of laparoscopic surgery where the surgeon is on a console right next to the operating bed and is able to control tiny instruments in your body through laparoscopic keyhole port sites.
You know, I have read that video games might have been helpful to young people if they grow up to be surgeons and do that, because it's much like operating a video game.
Yeah, you're actually correct, and actually there have been even studies looking at newer medical students that are now interested in robotic surgery and how their video game experiences help them in their surgical training.
All right, so if a surgeon says to us, do you want your surgery with a robot or laparoscopic, how does a patient make that decision? What are the advantages of each?
Well, I definitely think there's some unique advantages to robotic surgery. The magnification on the robotic camera is unparalleled. It really gives you a three-dimensional view of the entire surgical field, and also it allows you to operate almost like with your entire hand motion, unlike with laparoscopic surgery, which is more stick movements. Robotic allows you to use your wrists and perform 360-degree motions with the surgeon's hands through the robot, much more easier than with laparoscopic surgery.
And what about other advantages? I mean, is there less surgery, less recovery time, or what was the list?
So with the main advantage with laparoscopic surgery, and particularly robotic surgery, is definitely less blood loss, minimal, less pain, quicker recovery, going back to work, long-term. Scar tissue, so there are some advantages in terms of less blood loss with less blood transfusions and definitely a quicker overall recovery.
As a urologist, how are you using this for men and for women?
Yeah, so we use it for men and women. Men primarily with prostate surgery, particularly for prostate cancer, for prostate removal, and then for women for any sort of reconstructive surgery, be it prolapse repair or the main thing being prolapse repair. And then for both men and women for kidney cancer, for either partial removal of mass on the kidney or entire kidney removal, as well as bladder cancer for removal of the bladder or partial removal of the bladder. And then various reconstructive surgeries in men, women, and even children, whether it be reconstruction of the kidney tube or removal of a stone or reimplanting the kidney tube back to the bladder.
You know, even now when you talk about robotic surgery, it brings this thing to our mind about Star Wars. It seems like there's this giant robot that's going to come into the room and help out, but it's really very simplified, isn't it?
Yeah, and with newer robots, the technology is getting smaller and smaller, and the robots aren't as big and bulky anymore, and even the port incisions are getting smaller, and who knows, maybe in the future you'll be able to basically have a robot that can easily move from room to room.
So as somebody who uses this, why are you in favor of this?
I definitely think that patients have much less pain after surgery with it. I think patients are able to get out of the hospital quicker with it. And I don't think it impairs any sort of ability to do the surgery, and I think most importantly it's safe.
All right, any misconceptions you want to clear up?
No, I think the biggest misconception is that it potentially could not be safe for certain operations. I do think in the right hands, in someone that's done a lot, it is a very safe and equivalent to any open or laparoscopic surgery.
All right, thank you.
Thank you.
Dr. Pranav Sharma is here from Texas Tech Physicians to explain robotic-assisted surgery, which he uses in his profession of urology. So it's nice to see you. Thank you for being here.
Thank you.
And thank you for joining us. We'll see you next time.